How do things work? Things that give so much joy and happiness. Things of beauty and balance. How does it all come together so perfectly? How can the right support drive optimal health? How can we help manage chronic illness? How can shared intelligence spark brilliant solutions? How can doctors and patients build even stronger relationships? How can we improve the quality of healthcare and make it more affordable? How do we bring everything together so that healthcare works for all of us? We know how. We are the how. Optum. How well gets done. How do things work? Things that give so much joy and happiness. Things of beauty and balance. How does it all come together so perfectly? How can the right support drive optimal health? How can we help manage chronic illness? How can shared intelligence spark brilliant solutions? How can doctors and patients build even stronger relationships? How can we improve the quality of healthcare and make it more affordable? How do we bring everything together so that healthcare works for all of us? We know how. We are the how. Optum. How well gets done.
Good afternoon, everyone. Welcome to the first iteration of Practical Partnerships for the Pandemic. I'm Joy Alambay, the Executive Director of Asia Society Philippines, and we'd like to welcome you all on this brown bag or luncheon talk. So, Practical Partnerships for the Pandemic is a series of online conversations on how the private and public sector in the Philippines can work better to beat the COVID-19 pandemic, particularly at our point in time now through large-scale and fast vaccinations. Today, we open with the first of this series with the theme Large-Scale Vaccinations, Government and the Private Sector Together. So with that, let me now call on our partners, Optum, UnitedHealth Group's Vice President for External Affairs in the Philippines, and our Asia 21 Fellow, Attorney Darwin Mariano, for his opening remarks. Darwin?
Thank you very much, Joy, and thank you to everyone listening to us. Thank you for spending your lunchtime. For those of us in the Philippines, thank you for spending your lunch with us. We hope to be able to give you a really, really interesting, but more importantly, a constructive, productive conversation around how the many parts of Philippine society can really come together. That's really the purpose of why we work with the Asian Society, us and Optum, Optum and the Asian Society, really to make sure that these kinds of conversations continue to happen. Because right now, as the pandemic continues to rage, greater coordination, greater support for each other, greater cooperation across the private sector and government, and then within the many subgroups of those two very large segments of our society, those kinds of cooperation need to be enhanced. And I guess that's why we felt that it was really, really important to bring these very esteemed guests together. And we hope that you will learn, and that more importantly, you will join the rest of the country in this collective effort to make sure that we survive and that we get over and we're able to beat this COVID-19 pandemic as soon as possible for the benefit of all of the Filipinos. So back to you, Joy.
Yes, thank you so much, Darwin. So this morning, this noon, we are very fortunate as this and succeeding conversations will be moderated by Dr. Albert Francis Domingo. Doc Albert obtained his Bachelor of Science in Molecular Biology and Biotechnology and Doctor of Medicine degrees from the University of the Philippines. He is a health systems specialist with a Master of Science degree in Health Systems and Public Policy from the University of Edinburgh in Scotland, obtained as a Chevening Scholar of the United Kingdom. He's also familiar with the general principles of health law, as he has over a decade of experience in global public health at country and international levels, having worked with USAID, the World Health Organization, and health officers at all levels. Dr. Domingo uses a health system strengthening lens in advising ministries of health, social health insurance agencies, national and local government authorities, our development partners, healthcare providers, and patient groups. He has worked on health system functions in the context of maternal and child health, sexual and reproductive health, HIV/AIDS, tuberculosis, malaria, and pandemic response, particularly COVID-19. So, Doc Albert, welcome again.
Thank you so much, Joy, and good afternoon to everyone, to all of our viewers and listeners, both live, and as I understand it, it also happens that this gets posted later on, and we do have people who watch the recordings. So thank you for that kind introduction, Joy, and nice to hear from you, Darwin, and welcome to everyone. At this point, let's get straight to business. It's a lunchtime. It's a middle of a very hot, I'm just looking at the temperature, maybe 34, 35, but feels like 40 degrees centigrade. But you're not here to listen to the weather forecast. You're here to listen to our esteemed panel composed of the following. I'd like to introduce our guests for this lunchtime brown bag on public-private partnerships aimed at solving the pandemic. Let me begin with introducing the Honorable Mayor Marcelino Marcy Teodoro, who is the Mayor of Marikina City. Mayor Teodoro has been active in local government since the early 90s when he was first elected as a councilor. And prior to getting elected as mayor in 2016, he was a member of the Philippine House of Representatives, representing the 1st District of Marikina. Good afternoon, Mayor Teodoro. Sir, naka-mute pa po yata, sir.
Good afternoon,
Yes.
Doc Albert,
Good afternoon.
and to everybody, and thank you for this opportunity. It's an honor.
Thank you, Mayor.
Salamat.
Right. I'll come back. I'll come back to you, sir. Let me introduce the next panelist. So next on the list is my very good friend, Dr. Beverly Lorraine Ho. Dr. Beverly Lorraine Ho, you probably have seen her or heard her in the many vaccination sites. She gives, she doesn't do it live, of course. She gives the briefing. She gives a lot of advice. So Dr. Beverly Ho is the concurrent director of the Health Promotion and Disease Prevention and Control Bureaus at the Department of Health Philippines. She has done extensive work to provide much needed evidence to support health system reform. She has directly contributed to the passage of key legislation on sugar-sweetened beverage taxes, tobacco taxes, and universal health care, and the institutionalization of the health technology assessment process. At the international level, Dr. Bev has provided technical assistance to governments in Southeast Asia on health financing, maternal and child health, and health impact assessment. A co-founder of the Alliance for Improving Health Outcomes, Bev is also a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative, and the Atlantic Institute. Dr. Bev holds an MD from the University of the Philippines and an MPH in Health Policy and Management from the Harvard T.H. Chan School of Public Health as a Fulbright Scholar. Good afternoon, Dr. Bev.
Good afternoon, Albert. Thank you for the very generous introduction. Good afternoon also to all our listeners today, and Mayor Marcy, hi po.
Thank you, Doc Bev. Allow me now to welcome our next on the list, Mr. Romel Tambunting Juan is the President and Chief Executive Officer of native food chain Binalot Fiesta Foods and General Manager and Vice President for Sales and Marketing of Jeep Bodybuilder and Exporter MD Juan Enterprises. You might be curious, he is not inside the restaurant. That's a virtual background, but that's one of his restaurants. Armed with a degree in marketing from De La Salle University and a master's in entrepreneurship from the Asian Institute of Management, Romel immerses himself passionately in marketing and promotions, calling on people to make a business out of Binalot by investing in franchise stores. He emphasizes nationalism and corporate social responsibility in his business ventures. Good afternoon, Mr. Romel Juan.
Good afternoon, Doc Albert. Good afternoon, Mayor Marcy. Good afternoon, Doc Beverly. Thank you for having me. I'm really excited to be part of this panel. I'm really excited to share because I think vaccination is really the answer to this pandemic, and I want to share with you what we've done with our companies. Thank you.
Thank you. Thank you so much, Sir Romel. And finally, but definitely not the least, I'd like to introduce Rebecca Beck Richmond. Beck is the director within the Optum UK advisory practice and an expert in international health and social care strategy. She currently works with Integrated Care Systems and Aspirant Integrated Care Systems in England, where she is calling from right now in this early morning. Thank you so much for being with us here at this time, Beck, to develop and implement a sustainable population health management or PHM strategy. She also plans and facilitates community of practice events in collaboration with NHSEI. Beck is experienced with an international career in healthcare strategy, advising senior hospital and health system executives across the UK, Europe, Australia, Asia, Canada, Middle East, and Latin America. She advises the provider, payer, government, and industry sectors in many global markets. Beck further supports implementation of PHM strategy through design and delivery of workshops, board-level sessions, and virtual training to inspire, advise, and enable multidisciplinary leadership teams to collaborate effectively on PHM execution. Good morning over there, Beck.
Good morning, and thank you so much for allowing me to join this esteemed panel and to spend some time with such a great group of people in the audience. So thank you so much. It's a privilege to be here.
Thank you, and welcome to everyone again. So we have this panel with us, and the time is 12:15. We're going to do this as our colleagues, our friends are all eating lunch here in the Philippines and probably having about to have breakfast in the UK, we will be hearing about COVID-19 again. No, not just COVID-19, but the angle that there is a role. We hope to be able to discuss the role of public and private partnerships, but not your usual. So let me begin by asking our government guests now. So we have Dr. Bev and Mayor Marcy. Perhaps I can ask Director Bev first. Can you give us a brief overview of the major steps in COVID-19 vaccination rollout? What are the entry points or opportunities for the private sector at the national level, perhaps, to partner with government for the purchase and distribution of vaccines? Over to you, Bev.
Thank you very much, Doc Albert. Well, basically, we follow the major principles that we have for our COVID response and apply it to the vaccination program as well, no? Which is national government enabled, LGU led, no, and people-centric response. And this really means that we recognize that the way the structure of the government is that it were devolved, and the leads actually in implementing programs on the ground are really the local government units. And of course, the local government units are really free to bring in civil society members or civil society organizations and the private sector in order to help them implement our programs better. So that said, when we look at the vaccination program, oftentimes it's easy to say that maybe the biggest cost of the vaccination program is the vial itself, no? And that's why we've seen that a lot of us has debated around, okay, who will buy the vaccines now? And the national government has secured sufficient doses to cover all eligible population, no, for 2 doses at least even. And we know that recently the private sector has also started buying their doses. But I think what's often not highlighted in this vaccination program is the fact that your operations or the implementation of the vaccination program is actually really what's going to cost money. That would mean your HR cost, your operations cost, tubig, kuryente, no, in the areas where you do your vaccination, and even the supplies, no. And I think in the last few months that we've started implementing the program, there's increasing recognition from our partners that this is where more of the resources needs to go in. And so we know that some of our LGUs have been reassured the doses will be provided. Just use whatever money you have in order to support operations, right? That's the counterpart. And then for private sector partners, we're very thankful that many of them have also secured vaccine doses, but currently the support is really going into not just setting up private vaccination sites, but more importantly, we're getting a lot of support in terms of technical assistance, no? So the big companies, their supply chain people, their logistics people are now helping the government to do the projections, which is very typical, no, for big franchise of private
That's what they
sector.
do.
Yes, no? So I think we're really getting a lot of support for that. So overall, that's really where we are in terms of the COVID-19 vaccination program.
I like Dr. Bev how you emphasize now, because everyone seems to be fixated on the vial, on the vaccine itself. But little do people appreciate that behind that vial, for that vial to, it's not even the vial. I mean, it's not the whole bottle that goes into the arm, but doses from that vial. Before that vaccine reaches the arms of individuals and gets people vaccinated, there's a whole campaign under it, no, behind it rather. And leading the charge in this campaign, making sure that this happens, are our local government units, our LGUs. And that's my segue to one of the most dynamic, one of the most pioneering ever since the pandemic started. Mayor Marcy Teodoro has always been one of the mayors who has parabang he does not hesitate. He is decisive. If he thinks this is a solution that is actually worth exploring, he goes and moves forward. Sir, Mayor Marcy, I'd like to hand over the floor to you. And could you let us know, having heard from what Director Bev said at the national level, what have been the challenges? What have been the operational constraints right now in trying to bring up the number of people that we are vaccinating daily, sir? Mayor. Mayor, can you unmute, please?
Yeah. Okay. Yeah. Albert, Doc, thank you very much. At the outset, Doc Albert, I simply listen to Director Beverly every time I go to our vaccination center. You will see her reminder to everybody to be vaccinated and to follow minimum public health standards. At the outset, I think these are the two things that we should simply do as in order to be able to have an effective COVID response. First, to uh, uh, observe minimum public health standard, and second, to have ourselves vaccinated. As simple as that. Uh, we should be able to oversimplify or simplify at least the process of vaccination. It's a question of logistics. Having the capacity uh, for a number of people to be vaccinated. I think the solution is already present in the system. We should simply remind ourselves to exercise uh, the process. For example, in Marikina, when the Department of Health told us that we need to be able to inoculate at least 3,500 to 4,000 individuals a day. So we put up the facility, the capacity to inoculate a number of people in order for us to be able to meet the number of individuals to be inoculated for a period of time so that we will achieve what we call herd immunity. So in our case, we do the manning, the logistical requirements, but the problem really is the availability of the vaccines. And I think this
Okay.
is a challenge left to the national government. We use a tripartite agreement in order for a local government, for example, in
Mhm.
our case, and also for some from members of the private sector to procure vaccine through this modality of a tripartite agreement. And challenge
Mayor,
really is, yeah, yes, Albert, yes, Doc.
yeah. Do you have examples? You mentioned the tripartite agreement. That seems to deal mostly with the procurement. But now that you mentioned that supply is an issue, what about issues like vaccination sites or the cold chain? Have
It's not,
you had examples where the private sector joined with you in Marikina for these particular steps, or even the campaign, the information campaign? You said the reminders are needed.
yeah. In our case, we put up our own cold chain facility, the local government unit. We have the capacity to store all kinds of
Okay.
vaccine, even vaccines of ultra low degree. We put up the facility for the purpose. We also train our doctors. In fact, we have 24 groups of vaccinators, of doctors, trained by the DOH, and we try to continuously recruit doctors for the vaccination. But the problem really is the availability of the vaccine. Yun yung problema namin.
Availability.
Oh yeah, oo. We have a very limited resources in the case of Marikina. So we
Okay.
put up the logistical requirement for vaccination for a period of six months, and it started last April. So we're
Mhm.
eating already up. We're eating the almost 2 months of that period in terms of resources. The problem is the availability of the vaccine. We could inoculate
Vaccines.
our capacity in our vaccination facilities, uh, 3,000 to 5,000 daily. It's 3,000 to 5,000 individuals. But the problem is that the
Mm.
vaccine is not really arriving given that number.
All right, all right, Mayor. Let me use that to pick up from that that you mentioned, and let's say, for example, that the vaccines already come. We are seeing the National Task Force, flight after flight, plane after plane, 500,000 of brand S, and then 1 million of brand A, maybe another million of brand P. Whatever the brand is, the vaccines are starting to come in. And we can also connect it with global news. We are seeing that in the US and even in the UK and Europe, the countries who started earlier with vaccination, they're starting to already transition, meaning the stocks that they have, they're starting to diplomatically negotiate with countries and then even firms. Let's say that the vaccines come, and now I'm going to shift the discussion to Mr. Romel Juan. No? Let's say the vaccine comes, and Mayor Teodoro and the other mayors say, now that the vaccines are here, our quotas of around 3,500 to 4,000 doses, or inoculations rather, injections, jabs per day, has to be brought up. Sabihin bigla, Director Bev and the NTF will start saying, oh, we need to increase jabs to 7,000 per day for Marikina, for example. Sir Romel, from your perspective as a private sector participant and hearing those entry points, and given your core business, dito talaga ako, this is where I'm very curious. No, the Binalot restaurant, when the program was being designed, and this is my sort of curiosity now asking, sir, how could Binalot restaurant, or even the jeepney business that you're doing, the manufacturing or assembly, how can you help Mayor Teodoro, for example, in a vaccination campaign? Over to you, sir.
Yeah, very basically, as early as November last year, I'm part of the private sector initiative to buy the vaccine. So we bought our stash already, our stocks for that. But of course, it's gonna arrive in July, So I really managed my expectations already that siguro sa July pa, we'll have to be careful until July. But fortunately, vaccines came to our LGUs. So actually, the challenge became more basic. It's not the supply anymore. It's how to convince our people to get vaccinated. So I did a survey with our people. The factory for jeeps, we have about 200 people there. Siguro mga 30% lang are willing to be vaccinated.
And then 30% lang.
Yes.
Much lower than what we're picking up. I think the survey said mga 50% now, so 30%.
Yes.
Okay, go ahead.
And then I compared it with Binalot. With Binalot, we only have like 60 people. Higher, So siguro may mga 40% were willing to get vaccinated. So it was really a challenge kasi available na in our LGU yung vaccine. So what I really did was I made a campaign, I put up a messenger group, and I got my vaccine early on. Pumila lang ako, nag-walk-in ako, I chanced it. Unfortunately, those vaccines for our LGU were meant for frontliners, but a lot of frontliners didn't get the jab themselves. So there was a slot for me with the comorbidity, so I got it. So I posted it and I made a video for our people on why you need to get a vaccine. Hindi kayo magiging zombie. Huwag kayong matakot. You have to be. You have to know this. They have. Siguro it's the algorithm of Facebook, because Messenger is free, so that's their main chat group entryway, And they really get these messages. They really get these messages that the government's gonna use it to tag you. It's all a Bill Gates scam. It's going to make you a zombie. So isa yan. You have to address that one by one, and you have to really,
one.
I knew it was coming because as early as siguro mga November last year, my driver was already showing me his messenger. Sabi niya, sir, look at this. Masama daw yung hindi daw totoo yung vaccine and everything. So I had to educate him.
Oh, wow.
So I was able to convince him. But it was really strongly I was faced with the reality when my sister asked for my help because both his drivers didn't want to get the vaccine, and this guy has been with her for like 26 years. He was willing to leave his job, just lang hindi ma-vaccinate. So I went there, all the way to Alabang. I live in Parañaque. I went to Alabang, and then I used my driver as a guest speaker. So I sat them down. I explained to them, guys, I got the job. I'm not a zombie yet. We're doing this for
Not
you,
yet.
to protect you, not yet. To protect you, to protect your family, and to protect the family that you're servicing, that you're working for, because they love you.
Right.
Also, they want to give you this safety. And then my driver, this is the clincher. My driver tells him, if you die from COVID, they will cremate you right away. Your family will never see you. That's when their eyes, popped up, and that's when they realize, hey, I really need. It was a about 45-minute discussion with them. We were able to convince them. So it really needs to be this, one by one, you need
Right.
to talk to them. Because I feel that by June, July, when all the vaccines come already and we'll have enough stock, that's going to be the challenge. And I'm thinking maybe we should have an FB campaign also, so that pumasok sa algorithm nila, and they can see that it's not fake news that they see. We really need to make a campaign for them. That's the first challenge for me.
Right. I'm seeing a common thread. Thank you, Sir Romel. I'm seeing a common thread. We started the discussion with Director Bev, who is the Director for Health Promotion of the DOH, giving us an overview of the whole process. But she did not touch so much on the communication side. No, she just gave us the overview. And then we moved on to Mayor Marcy, who told us that we're actually ready. The ground is ready. The systems are in place. We're just waiting for the vaccines to come in. And then now, this is an interesting take that I took. We heard from Mr. Romel of Binalot. No, it's a fast food. It's a restaurant. It's a food industry, and also the jeepney business. I was expecting to hear na mamimigay that Sir Romel will be giving Binalot for while being vaccinated. But what he actually pointed out is his role as they say, the father of the family. No, parang if the family is the company of 200 jeepney manufacturers, 60 restaurant workers, there was already hesitation within the family. And literally also within his own family, his own household, there was hesitation. So he had to step in. So there seems to be a communication thread, no? A health promotion and communication thread. And we're seeing that at least Romel is stepping up for his part of the world, his little private sector group. Now let me move the floor, or offer the floor to Beck. And I'm going to ask Beck, how can we bridge? How can we have more, not webinars, but more bridges between the likes of Romel, of Dr. Bev, of Mayor Marcy, so that we have these discussions, right? So Beck, in your experience abroad, what have been the factors needed to bridge government and private sector when it comes to COVID-19 vaccination campaigns? What needs to happen for them to start talking with each other?
Thank you. Actually, I would summarize it as one thing, and then I'll give you some examples. But it's a willingness to break down barriers in fundamentally different ways and to share. So there are three areas I think that we've been really struck by that have happened here in England, but also in a few different countries that we've been monitoring. I think the first one is around sharing risk to enable innovation. So I think between the government here, the NHS, and then the private sector, there's been a willingness to push forward with managing risk and sharing risk to enable things like overlapping trials, to bring in play not-for-profit contracting very early on, and to make sure that the risk was clearly shared. So there was a comfort level there in a fundamentally different way. And I think in a way that's represented by everybody else that's on the panel. The second one was a willingness to share data. So we spend a lot of time working with linked data sets, trying to bring private and public sector data together to allow us to paint a picture of the community that we've never seen before, so that we can understand who are the people who might be reluctant, who are the people who need to be most protected, who are the people who perhaps we don't normally engage with from a healthcare perspective for one reason or another, but the private sector engages with them as consumers. Can we bring our data together? And then the last one that I think Beverly in particular alluded to, and also Mayor Teodoro, was around infrastructure. So willingness to share sites where people can go to be vaccinated, a willingness to share manufacturing capabilities, which has been an amazing thing to see from the private sector with the fill and finish campaign. I don't know if you've seen that work, but multi-vial filling capability that's existed for a long time in the private healthcare sector and medication sector, not something that's ever been done in the NHS before. So the government broke down some barriers there as well. So it's really a willingness to share, and specifically a willingness to share risk and knowledge, that I think has made everything so much more powerful in the response to the pandemic. And hopefully the case will be the same there in the Philippines too.
Great. There you go. My microphone has been active. Thank you so much, Becca. So we have finished one round of the panelists. I'm now reaching out to the audience, those listening to us, watching us live on Facebook and other channels. If you have any comments or questions, please go ahead and comment them in the appropriate box in your interface. And our colleagues backstage will be monitoring and posting those questions for the discussion of the panel. But we also still have a few questions that the panel is very much ready to answer, right? So looking at, we heard perspectives on vaccination. I do realize that the focus of this first webinar on partnerships between the public and the private sector to end the pandemic has been focused on vaccination. But I just can't hesitate to ask, beyond vaccination, this pandemic has also showed us where the gaps are, where the challenges are when it comes to our health systems, both at the national and local level. Let me flip it around now. So we heard from Dr. Bev that a lot of the implementation, if not most, all of the implementation happens at ground level under guidance of the DOH as its technical support, right? It's not the DOH controlling the LGUs, it's more of the DOH supporting the LGUs. And I'm going to hand over to Mayor Marcy again. Mayor, beyond vaccination, and it's a chance now to hear from you. You've been at the forefront as a mayor of Marikina ever since the pandemic started in early 2020 up to now, and we're still not seeing the end, not immediately. But what have been the gaps beyond vaccination? Healthcare delivery, in the minimum public health standards. What do you think are the areas for improvement, either in Marikina or even in other LGUs, that should be addressed, Mayor?
I think we should be able to recognize the fact that we need to employ a whole of community approach on this matter. We need to be commonsensical, pragmatic in our approach. We should, I think, listen more to our people. Not from the experts, I think. I mean, the experts have said already what we should have done. I think we should now fill in the gaps between what we think is appropriate and how our people perceive the problem, how our people perceive the problem. For example, it's not a problem of people wanting to be vaccinated. In the case of Marikina, for example, our data here is that we have an abundant number of people who want to be vaccinated. But the problem is the regulations that we have on the prioritization who will be vaccinated. Remember the fact that what the IATF is allowing is the vaccination of people belonging to A1, medical frontliners, A2, senior citizens, and A3, those individuals with comorbidities. In the case of Marikina, meron kaming hindi nababakunahan around 50 to 55,000 individuals. They want to be vaccinated. We want them to be vaccinated. We want to inoculate them. Our capacity, our system can accommodate them. But we could not proceed with the vaccination because we're not receiving the go signal from the IATF for these people belonging to A4 category, A5. A5, incidentally, are those belonging to the National Household Targeting System.
Yes.
O indigent. Yung A4, alam naman natin, economic frontliners, and we know how important they are. Tapos yung C category, ang daming gusto magpabakuna. If we will only receive the go signal to vaccinate them and receive the supply of vaccines for them, lahat ng LGU ready na naman eh. It's not a problem of convincing people eh. res ipsa loquitur eh. The act speaks for itself
Yes.
eh. Nagpapabakuna yung tao, nagagalit nga sa amin eh. Sa akin, maraming nagagalit ngayon sa akin. Dahil ayaw ko raw silang bakunahan. Kanina nga, I've been convincing Secretary Charlie and Sec Vince this morning. Sabi ko, sana payagan na kami. Give us the leverage, the flexibility. Yung categorization, let us simplify the categorization. Ano yung categorization? Simple lang. Those people who want to be vaccinated and those people who don't want to be vaccinated. Ganun na lang kasimple. Because mas maraming mabakunahan, we will, the earliest possible time, reach what we call herd immunity.
I like Mayor. Yeah, I like how very pragmatic, no?
Kasi hirap na hirap tayong gumawa pa ng campaign na paliwanag na gusto magpabakuna, may benepisyo yung bakuna. Si Sir Romel, kanina very simple yung sabi niya. Magkukumbinsi mo yan pag may kaibigan siya, may katabi siya na nagpabakuna.
That's right.
Maraming magpapabakuna. In our case, in our city, half of, madami, meron kaming mga, more or less, mga 60,000, 70,000 individuals na hindi namin mabakunahan dahil wala pa siya doon sa category. Hindi namin mapaliwanag ngayon doon sa tao na hindi ka pa pwedeng bakunahan kasi wala pa yung category mo, hindi pa ina-allow ng IATF. Tinatanong nga ng tao, ano yung IATF? Ano yung function? Hindi nga niya alam eh. Nakakaintindi, tayo lang. Pero I think the system was created simply to implement a categorization and a prioritization list because of the limitation on the vaccine. Kasi kung walang limitation, anybody can be vaccinated as long as the individual is medically eligible. Yun lang ang importante, yung medical eligibility niya. No?
Thank you, Mayor. No, I see the Mayor's pure intentions, and the Mayor is also, kumbaga, he said it well. We all want herd immunity to happen. Ang nagkakaiba lang siguro ng perspectives, and I'm going to pass over to Sir Romel and then Doc Bev. No? Nakita ko, while Mayor was saying, did you notice, mga ladies and gentlemen, si Sir Romel was actually nodding. Si Doc Bev, there was a point bigla siyang nag-shake ng head. I'd like to find out, why were you nodding, Sir Romel, and why were you shaking your head, Doc Bev? In which particular instances po? Okay, Sir Romel first.
Okay, Doc Bev, just correct me later. But again, I echo what the Mayor is saying. I really believe we just have to make it as easy as possible for people to get vaccinated. Now I'm willing to forgive the past months already because we were learning. People went to the vaccination centers. They waited 7 hours. I myself waited for 6 hours. I think by now we should know a better system than that. No, because I just look at, of course, you look at the internet and the other countries. In other countries, it's just a drive-through vaccination, diba? So drive-through ka lang, bakuna, alis ka na. No, but here we have to wait 7 hours. But of course, yun nga, we were learning in the start. No, one thing is you have to get your blood pressure taken. My blood pressure was actually elevated that time. No, well, I guess because I waited 6 hours already and I was so anxious. So my blood pressure shot up, and they said, okay, wait again. I had to wait 15 minutes, and that added on to the long line that we're waiting. So sabi ko nga, tama si Mayor if the people are willing to get vaccinated already, let's make it as easy as possible for them. The vaccination center should be everywhere per barangay, not just one mega vaccination center where they really pile up, especially pag malaman nila na Pfizer or Western vaccine yung mga vaccine na yan. I'm a very big promoter of any vaccine. Sabi ko, the best vaccine is the one in your arm. Don't you cannot afford to wait anymore. While people were waiting, there was the second wave, and then everybody got sick to the first degree. I mean, I know you felt that in April, halos first degree lahat, may alam tayong kaibigan na yung nanay may sakit, yung buong pamilya nila nagkasakit. So again, I'm calling on of course the government to help us make it easier. Kami nang bahala sa information campaign. For my people, I will sit them one by one and convince them, and then I will have my driver as a speaker again, showing that he did not become a zombie. And they will all want to get vaccinated, but let's just make it easier for them. Yun lang, that's all I ask.
Thank you, Romeldo. But my thoughts are: could there be a reason why? I mean, there must be a reason why the prioritization framework was instituted, and para bang what could be the situation why government at this point, national government at this point, is still holding on to what we call A1, A2, A3. So for Beck's benefit, A1 would be your medical frontliners, A2 your senior citizens, A3 your adults with comorbid diseases, and then Mayor Marcy mentioned already A4. A4 are the economic frontliners in essential businesses, and then A5 would be the indigents. Dr. Bev, so you were shaking your head a bit a while ago. Is there a particular reason why there may be, I wouldn't say a disagreement, but maybe hesitation on the part of the national government, why we're still patiently holding on to A1 to A3? Dr. Bev.
Thank you, Doc Albert. I think overall, no, we shared the same goals with Mayor Marcy and also Sir Romel, no, that we want as many people vaccinated as soon as possible. However, we also know the peculiarity of COVID-19 disease, right? And how our hospitals get filled, no, when the time comes that a lot of people get infected. And we know that the specific population group actually is more predisposed to hospitalization and deaths, no? And that would be your healthcare workers, that would be your senior citizens, and that would be your people with comorbidities. And that's why wherever in the world you actually see, like even how fast they did it in Israel and in the US, it was never all at once open the gates, right? It was always prioritize these, and it might not be A1 to A5, but they do it by decade, no? They start with people 70 to 80, then 60 to 70, etc. No? And only up to a certain time, really did they start opening it up. Second is, Mayor Marcy said it correctly already kanina, no? There's really a lack of vaccine supplies, and it's not as generous as the supplies that they have in the Western countries, largely because of some what we call commercial determinants of health, right? And in as much as we'd want the stocks to be all here, it's not within our power, no? So that said, it's not only NCR or Marikina City that we're talking about. We have an entire country, no? And even if we finish A1 to A3 in Manila, which we haven't, no? Less than 50% of senior citizens have actually been vaccinated, more so the people with comorbidities. You actually have other areas in the country where they even haven't gone to the senior citizens, no? So I guess to a certain extent, we value wanting to reach herd immunity faster, but we also need to value equity and fairness, especially to people who are more predisposed to being hospitalized. So I guess at the end of the day, gusto naman talaga natin to lahat, no? But there are constraints, and we're working with those constraints. But I'd also be very happy to announce to you that in the coming weeks, no, there will be options already to open this up with really priority lanes given to A1 to A3. Hindi naman natin sinasabi na you have to wait for them to finish like 100% A1, A2, no? But really already start opening it up, similar to how, you know, our private sector restaurants would do it, diba? Na meron kang priority lane, hindi pipila si seniors, no? So may mga ganun namang mechanism, and that's largely also because of feedback, no? And that's why we need these kinds of conversations, open conversations also, para
precisely
more I guess progressive ideas can come in. So yun lang naman.
I can't hesitate, but also make a suggestion myself. I'm thinking buy one, take one. No, buy one, take one, or buy one, get one. Bring a senior citizen, and if you are not a senior citizen, you will also be vaccinated. I mean, just to facilitate. I'm just being creative, thinking on top of my head, right? So I've been hearing that a lot of A3 or even A4, no? So adults without comorbids are willing to be vaccinated. They might have seniors inside their households, but when they're brought to the vaccination center, the experience is somehow varied. Some LGUs are saying, okay, since you're caring for the senior, we will also vaccinate you. Some LGUs will say, no, we have to strictly apply the framework, and it's only the A2 who will be vaccinated. You'll have to wait and come back another day. Now, let me move the floor, pass over the floor to Beck. We'd like to find out, Beck, from your observation in the UK or even in other countries, has there been like a dynamic change or a dynamic alteration in the prioritization framework precisely because of the issues that I was surprised. This is not part of the script, ladies and gentlemen. We're supposed to be talking about public and private. We're still talking about public and private. So, Beck, what are your thoughts on changes to the prioritization framework brought about by ground realities, by the voice of the community, as Mayor is saying, by the private sector saying our own employees are willing to be vaccinated? What's your take on that, on the prioritization framework, Beck?
So a couple of things. I actually completely agree with Dr. Beverly Ho. I think segmentation has to be the key. First of all, there are going to be groups who are at risk much more significantly than others. And so I think looking particularly at that is the right place to start. I think certainly the age group element is an easy way to segment data. It's not perfect, but I'm very mindful that between cities and rural locations, access to data, access to technology that allows analytics so that you can segment groups isn't always consistent, to your point, in terms of supply chain as well. So looking at age demographics and sort of marrying that up with risk is the best way that we've seen systems in different countries get to this. So that sort of matrix view of age and then risk segmentation that Dr. Beverly was talking about has been absolutely the way forward. I do want to come back on a couple of points though, because I hope that Mr. Rommel will still let me into one of his restaurants if I visit the Philippines. But I do think there's a balancing act, because it's not always true that if you build it, they will come. So I do think there is still a lot to be done. And I saw a question from Professor Tapiador Sagradaka about how we can keep a nationwide vaccination program in place in the national agenda. It will be from building on what Mr. Rommel was talking about, going out there, communicating and engaging with individuals, but just opening up different sites of care to larger groups of people won't address it, because there will still be significant reluctance. So I think about some of the brilliant examples Mr. Rommel gave. How can you scale that up nationally? How are you targeting misinformation on the internet? Are you able to partner with private companies to use their marketing or behavioral science capabilities to understand how people receive information and what they want to learn? Can you coordinate with different systems and organizations rurally, perhaps volunteers or community groups, to streamline messaging? And then also thinking about influencers. So there's been a huge campaign across the BAME community here with very famous people. So much the same way as Mr. Rommel's been talking to his employees, making videos to go on national television to sort of engage with people, because people recognize them. They're TV stars, they're film stars, whatever it might be, to tell that story. And then my last point is around sites of care. And I actually want to celebrate you. So I've been sharing around the world, when it came to testing before we got to vaccination, the amazing work that's happened in the Philippines, for example, to engage with people in Catholic churches, given the religion there, to engage with people in different sites of care. We are seeing that partnership with the private sector and community here. So people are being vaccinated in pubs, people are being vaccinated in tattoo parlors, understanding where do people go? Where do people go? You know, where's engaging for them?
Right.
Many people are afraid of healthcare sometimes. Where are they comfortable going? Can they be vaccinated in Mr. Rommel's restaurants? You know, this is the kind of stuff that will scale and sustain the work that's happening. And that's the kind of thing, the partnerships that we're seeing form internationally.
Great points. Very great points, Beck. In fact, just the other night, I was looking on my social media feeds. I won't mention the name of the mall, but my Filipino colleagues probably has seen this. There's a mall that's supposedly offering turon, banana fritters, along with a vaccination. So I won't mention which mall, but yeah, I saw that on social media. The time is 12:55, and we promise that this will be a brown bag session only. In the interest of time, I'll just do one last round, beginning with the mayor, Mayor Marcy, and then Sir Romel, and finally Dr. Bev. The question that I'd like to throw, sorry, Beck, if you don't mind, I won't ask you anymore because I'll be using your input. Thank you, Beck. So, Beck gladly pointed out that we need to be in tune where people are going. We need to be able to break the barriers to achieve comfort levels we have not achieved before, to share data with respect to public and private partnership. My question, therefore, starting with you, Mayor Marcy, sir, what's your outlook from this point onwards as the vaccines start coming, as more supplies come in, as the NTF, as the IATF starts? Maybe Dr. Bev hinted that the framework might be relaxed a bit starting next week with priority lanes. Sir, what is your outlook on partnerships with the private sector? Over to you,
It
Mayor.
is, it is necessary. It is imperative. We cannot do it alone on the side of the government. Uh, my point simply is that we should listen to the experts and simply follow the experts' advice on this matter. Be more consistent with our policy in our implementation. We should be more practical. We know what to do. We simply need to act on it. I think that's the call of the time. We should act now, act with urgency. Uh, we've been listening to the experts in the past few months. Uh, us in the local government, we are adept to follow. Yun yung nature ng mga local government officials. Just give us the order and we will implement what is necessary and what is best for our people.
Thank you, Mayor, and that's a very telling sign of cooperation and leadership. No, when the mayor said, "Just give us the order," ladies and gentlemen, that's not a simple statement because when Mayor Marcy waits for a quote unquote an order from higher institutions, it's always the mayor who faces the constituents. No? Like he mentioned a while ago, people don't even know what the IATF is. They think it's Mayor Marcy who is calling all the shots. And this is the important point to make. No? So thank you for that perspective, Mayor. I'll pass over now to Sir Romel, flipping the question around. What is your outlook on partnering with government, with the public sector, coming from your perspective as a restaurateur, as a jeepney manufacturer? Sir, over to you. What's your outlook?
Yeah, this COVID-19 pandemic is the worst crisis that we have ever encountered in our business and in the business in the whole community, the business community, especially the restaurant community. Our sales are like 30% of before. It's barely, all the retained earnings that we've got in the past 3 years are now gone. And people are hurting. We're hurting. Our management with people who accepted the 50% pay cut just for us to survive. It's really, really hard. Of course, we know that vaccination is the answer to finish this, to end this pandemic. So we're very open. The business community is very open. Whatever we can do to support the government to end this pandemic, we are willing to do it. Early on, we have come up with our own campaign, the Bayani campaign. Before the community pantries, we were already accepting donations from individuals, and we would deliver to the frontliners. We're still doing that up to now. We even have a PayPal account that we promote abroad because a lot of Filipinos abroad want to help. So we're still doing that. And now I guess the next push would be to help in vaccination. And Beck, you're welcome to go to our store. Don't worry. Of course, Dr. Bev also. If ever you need our commercial spaces, our restaurants to be vaccination sites, or however we can help, we are all open because um, the the faster we can really administer
Vaccinate, yeah.
these vaccines, the
The
faster that
better
we
for
can
all of us.
somehow get back to normal and survive.
Right. Dr. Bev, looks like we have an open invitation to Binalot Restaurant. And if there is a Marikina branch, we will ask Mayor Marcy to join us, please. And maybe Beck will fly over. Dr. Bev, your perspective on this starting, and I wouldn't say starting, this ongoing public-private partnership for vaccination against COVID-19. Dr. Bev.
Thank you, Doc Albert. Thank you, Sir Romel. I'm such a fan of Benalot since college days. So I really look forward to that. And see, Mayor Marcy, so Doc Albert, diba, you talked about what other ways were we able to do public-private partnership. And actually, last year, we were able to really visit Marikina because they're a hotbed, no, of many of these partnerships for minimum public health standards, for making sure that facilities have water, citizens who are less able to afford it actually get their needed hygiene kits, for example, because you can't ask someone to wash hands if they actually don't have the basic necessities. No? So all of these were made possible through public-private partnerships, and I think we haven't yet maximized, no, the extent, but with the hopefully the steady stream of vaccines that will come, then we will really shift towards more a lot of operational innovations more than really just kasi ngayon, no, parang we can't step on the gas because of the vaccine supply. But we're very positive with Secretary Galvez's continued updates to all of us that vaccine supply will be more steady coming June. And with this, no, it will be easier also for LGUs and the private sector to plan, to think big, to plan big, because the supplies will really not be an issue. And thank you, Sir Romel, for your offer. I'll just get in touch with you directly so I can link you up with our operations team. Your offer is very much appreciated. So sa mga nanonood sa atin, I think what we need to get out of it is from our speakers today also is that lahat po tayo, no, mayroong contribution. Even as a single individual, your organization, your entire group, all of you can help in different ways to make sure that we vaccinate as many Filipinos so that we have really a good Christmas to look forward to. Thank you, Dr. Albert.
Thank you so much, Dr. Bev. And with that, I'll be closing the panel with this question. Just in retrospect, let's look at Professor Tessie Tapiador Sagadraca's question. She asked, how can we expedite the COVID-19 vaccination program? How can we keep a nationwide vaccination program in place in our national agenda? In fact, we can rephrase the professor's question into a statement. And we heard inputs from the mayor, from Director Bev, from Mr. Romel, and from Beck. And they all somehow contributed to the statement that, yes, we can expedite the COVID-19 vaccination program. Yes, we can keep a nationwide vaccination program in place in our national agenda. And I'll add, with our very able local government leaders like Mayor Marcy Teodoro at the helm, on the ground, at the front lines. Thank you so much to the whole panel, and I'll be closing it now at 1:03 p.m., passing it over back to Ms. Joy Alampay.
Okay,
Hi, Joy.
thank you, Doc Albert. Hi. I guess that's it for this afternoon. It was very engaging and as we say in Filipino, bitin. But nevertheless, the conversation doesn't stop here. And I'd just like to thank Mayor Marcy. Maraming salamat po for accepting our invitation. And of course, Doc Bev for your time, Sir Romel and Beck, and our host for this episode and the succeeding episodes of Partnerships for our Pandemic, Dr. Albert Domingo. Thank you, everyone. Please join our succeeding conversations this
Thank
coming
you so
June.
much. Magandang
Bye.
hapon po sa inyo lahat. Bye-bye.